came here, I'm like, how are we going to change? And Ida, you said something which we looked at ourselves and like, why didn't we think about this? So one of the things is, she's a 7-year-old, 6-year-old child. Would you treat a normal 6-year-old child like this? Would you let them lead? Wouldn't you teach them? Wouldn't you show them the world? Wouldn't you take leadership and give them your expertise or whatever that is? I think that's a big shift.
Hi, I'm Dr. Ida Menezes, and you're watching Autism, Lend Your Mind, Episode 3. Would you let a 8-year-old child lead as a parent? This statement came back to me not as a question that I asked, but as feedback from a parent who experienced a turning point in their child's progress. I still remember the day. It was 1st May 2024. When a family from Melbourne, Australia reached out to me with their 8-year-old girl. They had been referred to me by a close relative from Mysore who had been looking for my innovative approach. When they were in my office, I asked the parents this question. I understood that the child was given all the liberty and freedom, and every request was being attended to, whether it needed to be or if it was simply a tantrum. After 4 months of the approach, in a feedback testimonial, the father said, "This line changed the way I saw my child." For many parents, especially those raising a child on the spectrum, leadership feels unsafe. We parents are trained by fear of the diagnosis, that we can't train, control, instruct, and constantly correct. Somewhere along the way, we stop asking what the child is capable of and not allowing our leadership or parenting styles that we need to lead towards the child's progress. Instead, we allow our children on the spectrum to decide to act inappropriately, giving all allowances, knowingly or unknowingly. We know that their sensory sensitivities lead them to their behavior, yet they cannot be allowed. The disruptive behaviors progress as tantrums and then as meltdowns. This girl too had similar instances and meltdowns that prolonged for 3 to 4 hours, which handicapped their living. And it could happen anywhere, at home, when they were alone or with guests, the school ground, the restaurant, the supermarket, the car during travel, or even in the airport. Wherever they had to go with their sorry face imprinted beforehand. Let's pause and reflect. At first glance, the question sounds risky. As parents, we are wired to let the children lead, be carefree, and instruct. When we talk about an 8-year-old leading, here the autistic child, throughout the span of 8 years, was leading and ruling her immediate environment for her needs that were always within her comfort zone. She did not want to come out of it, as it was comforting, soothing, and giving her a sense of security with predictability. But life is not always so easy or comforting to anyone, be a normal kid or one on the spectrum. We all need to abide by the rules, regulations, have discipline, work in an organized manner at school, and have responsibilities extending to an 8-year-old. That's what our social environment has taught us. So when we have a diagnosis at an early as 18 months, and as we are aware of the spectrum, we must start to intervene early. Only then we will be in a position to hold on to the leash and take the necessary actions.
That would allow our children, including those on the spectrum,
to get into the flow and start habits that ultimately support development. If not so, children on the spectrum follow the same pattern in a disruptive or negative way. Due to their heightened demands and always trying to meet their needs, it forms into a habit, molding into our daily routines. In many neurodivergent children, because of their unwired brain, initially we need to take over excessively. We anticipate their needs, structure every moment, prompt every response, and correct every misstep. Over time, the child learns to choose their order of activities clearly, not showing signs of tantrums and opposition. The child learns to say, I want to try things this way, learns to negotiate, and is allowed to fail without fear, without pressure, without shame. What happens then? Remarkable changes. The child begins to think, the child begins to regulate, the child begins to own their actions. When I enlighten the parents that they are not leading the child, but instead the child is leading them, something within them is awakened. The moment parents in my practice admit that their children are the ones ruling and are the kings and queens is when they realize the lack of confidence within themselves. Often their statements are, my child is leading everything and we are just following their demands. What parents must understand is that leadership is not dominance, it is self-direction. For parents of children with autism, this shift is especially powerful. Many behaviors are labeled as non-compliance are actually communication attempts or overload responses. When we teach the child to follow small instructions, stress reduces on both parents and the child. Thus, when children are led properly, they don't become uncontrollable. They become more regulated, more connected, and more responsive. So, would I, as a parent, lead a 8-year-old child in spite of being on the autism spectrum? For many children on the spectrum, freedom without structure is not empowering. It is overwhelming. Unlimited choices, unpredictable environments, and constantly adjusting to their demands may look like kindness, but it often increases anxiety. What truly calms the child is clarity. When we teach a child how to follow simple routines, predictable transitions, clear expectation, we are not suppressing their individuality. We are building their internal regulation. We are teaching the nervous system to settle. And once regulation is in place, the child is no longer reacting to the world. They are responding to it. And then something beautiful happens. Within that structure, the child begins to explore. Within safety, the child begins to initiate. Within boundaries, the child begins to lead. This is what I mean by guided independence. It is not control, it is not force, and it is certainly not fear-based parenting. Guided independence is when the adult leads first with calm, consistency, and confidence, so the child can eventually take the lead in meaningful, developmentally appropriate ways. That is when leadership emerges naturally, not as dominance, not as defiance, but as self-direction. So, yes, I believe in letting a 8-year-old lead, but only after we have done the deeper work of teaching them how to follow, how to regulate, and how to feel safe within structure. Because before a child can lead, the child must feel secure. Secure in knowing what comes next. Secure in understanding boundaries. Secure in trusting the adult who is holding the framework, and then the leadership follows. Thank you for listening. I'm Dr. Menezes, and this was Autism Lend your mind. Every small shift you make today shapes your child's tomorrow. Until next time, stay curious, stay compassionate, and keep lending your mind.